Chickenpox, how to cure it. As my dear friends of YouTuber are, I want to apologize for not being able to upload information or videos for work reasons. Hoping that all of you are very well in health, in their homes and work we spend talking about this topic. Most children who get chickenpox recover completely. But chickenpox can be serious, even deadly, especially for babies, pregnant women, adults, and people with weakened immune systems. Make sure everyone in your family is up to date with varicella vaccines. Chickenpox can be serious. Before there was a vaccine, each year there were approximately 4 million cases of disease, more than 10,500 hospitalizations and approximately 100 to 150 deaths from chickenpox. Varicella vaccine is the best way to protect your family against this disease. Doctors recommend that children receive the first dose between 12 and 15 months of age, and the second between 4 and 6 years of age. People older than 13 years who never had chickenpox or were vaccinated receive 2 doses of varicella vaccine with a separation of at least 28 days. If you or your child only received the first of these doses previously, ask your doctor about receiving the second dose. 2 doses of the varicella vaccine are very effective in preventing the disease, including serious illness, its complications, and death. You can get chickenpox even if you have been vaccinated. However, the symptoms that occur are generally very mild. So you will have fewer blisters, little or no fever, but above all it will not be fatal and your recovery will be faster. How this virus is transmitted: through small droplets of vesicular fluid or secretions from the respiratory tract that are transported through the air, especially when the patient coughs or sneezes. It is also spread by being in contact with objects that have been contaminated. For this reason it is important that the patient is isolated. The probability of transmission among children attending the same school or among family members exceeds 90%. The contagion can happen from 1 to 3 days before the outbreak, the rash end, until the scabs have formed, which is usually between 5 and 7 days later. This makes early detection of infection difficult, since one person can infect others without having yet manifested the characteristic rash. Subsequently, it may take 10 to 21 days for the infected person to develop symptoms. Generally, the patients do not present evident symptoms before the outbreak of the disease occurs, which is accompanied by fever, tiredness, headache, and lack of appetite. Symptoms begin between 10 and 21 days after infection. The most characteristic is the appearance of reddish and flat spots, which gradually take on their appearance until they become blisters or vesicles. These cause a great itch, break easily and form crusts that come off and disappear in about 2 weeks. The process extends until the 6th day of the illness. The spots appear throughout the body, especially in the trunk and scalp in successive shoots. Healthy children can develop up to 500 skin lesions that sometimes leave a permanent mark. In severe cases the spots spread on the extremities and face. In addition, sores may appear in the mouth, eyelids, rectum, intimate parts, and respiratory tract. 24 hours later, the vesicles usually break and then dry up and transform into scabs. However, new blisters may continue to form until the 7th day. After a week, all should be covered with scabs and already healing. These scabs do not usually fall completely until 1 or 2 weeks later. Other common symptoms are fever, which can be moderate, elevated or not appear, fatigue, malaise, lack of appetite, and abdominal or head pain. These symptoms may precede the onset of skin lesions in 1 or 2 days. The vaccine prevents the disease in up to 80% of cases and is given to healthy children between 12 and 18 months of age. From the age of 13 they can be immunized with 2 doses. It can be applied together with other vaccines, such as measles, rubella, mumps, polio, hepatitis B, or meningitis. However, it should not be given to people with a weak immune system or to pregnant women. People who have not been vaccinated at the time and are at significant risk of complications receive antibodies once they have contracted the disease. Chickenpox requires antiviral and symptomatic therapy. Symptomatic therapy is done with analgesics, antihistamines, and creams or lotions that calm the itch. Its effect is palliative and transitory. We also recommend wet compresses or baths, warm, tea, linden as many times as possible to avoid itching and rupture of the blisters. This way we avoid infections. It is also consumed as a water of thyme. In case of bacterial infection, antibiotics are administered, and if serious complications arise, antiviral drugs are used. Other natural remedies are bicarbonate. One of the most popular remedies for chickenpox is the use of bicarbonate. That can be mixed with water and becomes a type of pasta. This paste can be applied with great care so as not to hurt the blisters on the skin, and then it stops drying. The active components of bicarbonate reduce the itching and pain of blistered skin and can help to prevent excessive scratching. Cilantro, one of the most natural, traditional remedies, include cilantro, as it can help speed up the healing process. Cilantro is a very potent herb with lots of beneficial organic compounds. Coriander and carrot soup is often seen as a varicella remedy in many countries. Sandalwood essential oil. A number of essential oils can be combined in bath water to create a perfect varicella remedy, but sandalwood oil is especially effective. Since it is antiviral and antibacterial, it can be applied topically or mixed with other creams and remedy pastes. This oil improves the health of the skin, reduces inflammation, and protects against any secondary infection that varicella patients are so prone to develop. Jasmine. The flowers and leaves of jasmine are used to make tea and in the bathroom that cures chickenpox. Soak the leaves well in a teapot or in a bathtub. The natural compounds found in jasmine are anti-inflammatory in nature and can provide considerable relief from itching and irritation. Good, my dear friends, I hope this information will help you and help in these cases of chickenpox. I wish you a very productive week, full of success, many blessings. If you like, do not stop giving it and subscribe to my channel.